Good day, I'm Dr. Dangleben, and on behalf of Patient Choice, this is Daily Educational Tidbit. Let's get back to regular programming. I just came from outside from doing some yard work, but always find time for our Patient Choice Educational Tidbit. What do I want to talk about today? I want to talk briefly about fat-soluble vitamins, okay? You hear about vitamins, but no one really specifies fat-soluble. Those of us in the medical field, we know what that is. The way I always remembered it from medical school is ADEK, vitamin A, D, E, K. Okay, these are fat soluble. They're essential. They dissolve in fats and oils. They stored in the fatty tissue. They stored in your liver. All right, and these are the primary ones that I talked about. ADEK. All right, the fat soluble valuable vitamins they accumulate in your fatty tissue, like I said, all right? And they can accumulate in the body, unlike the water-soluble ones that get excreted in the urine, all right? So this is important. So what are they? Vitamin A. Vitamin A, a crucial role in, we always hear about vision, right? Vitamin A and your eyesight, your immune function, your skin integrity, right? It's also vital during the reproductive health and cell communication to keep your cell healthy. All right. Good sources of vitamin A, the liver. I know some of us don't like that. Dairy products, fish, right? And there's a lot of plant-based sources. All right, for the vegans, carrots, sweet potatoes, spinach. All right, and that contains beta carotene that we obviously have heard of before. All right, that's a precursor that's converted into vitamin A in the body. All right, vitamin D, that is very essential. I talked about that prior. It's very important for calcium absorption. So that's general bone health, right? And also your immune system. Okay. It can be synthesized in the skin, as I mentioned before, all right? Exposure to sunlight. But remember what I said about that. You can go back and listen to the talk on vitamin D, all right? What are the dietary sources of vitamin D? Fortified milk, always talk about that, but I want folks to think of fatty fish, mackerel, salmon, egg yolks, right? And now they have fortified cereals, but read the labels, all right? And if you have a vitamin D deficiency, which we don't see a lot of in the Western world, you can have bone disorders, rickets and things like that, and osteopenia, osteomalacia, that will manifest itself in adults. Vitamin E, all right, that's an antioxidant, very strong antioxidant. It protects cells from the oxidative stress, the breakdown, so good immune function, all right, and good for your skin health. That's why vitamin E creams, you can use it on scars and things like that. So remember that. Good dietary sources include nuts, any seeds, any vegetable oil, all right, and leafy greens, all right, spinach, broccoli, etc. And then you have vitamin K. That is very important for blood clotting, all right, and bone metabolism. It is found in two forms. There's two forms. There's K1, right? It's phyloquinone. It is found in green leafy vegetables, kale, collard greens, and things like that. And then K2, you get it in fermented foods. All right. So a lot of fermented foods would have a K2, but you don't necessarily have to take fermented food to get your vitamin K. Right? I just gave you examples. Your leafy greens, such as collard greens, is important. All right. So that will adequate amount of vitamin K would prevent excess bleeding and support good cardiovascular health. All right. So remember, fat-soluble vitamins are critical, all right, for many of our bodily functions, all right, from vision to our immune to our skin, our bone and blood clotting. So again, just pay attention to the things you eat, read labels, and understand your own body and your own health. This is Dr. Dangleben on behalf of Patient Choice, talking about fat-soluble vitamins. Have a great day. Peace.